commonly associated with low potassium in the blood, or hypokalemia, partly because a lot of the conditions that cause hypomagnesemia, like diarrhea and diuretic therapy, are also responsible for hypokalemia. It's also thought that normally magnesium inside cells of the nephron tends to get in the way of potassium channels a little bit. So with less magnesium, potassium is more easily secreted, excreted, and wasted, which can lead to hypokalemia. Now, severe hypomagnesemia can also lead to low calcium in the blood, or hypocalcemia, since the parathyroid gland needs magnesium in order to release parathyroid hormone, which normally causes osteoclast cells to release calcium from bones into the blood. So without this magnesium, there's impaired release of parathyroid hormone. And it's also thought that magnesium is needed in order to respond to parathyroid hormone as well. And so both of these result in less calcium in the blood. Early symptoms of hypomagnesemia, though, are often neuromuscular. This happens because, under normal circumstances, at the neuromuscular junction, there are voltage-gated calcium channels on presynaptic neurons, which need to open and let calcium in to cause the neuron to release neurotransmitter and ultimately cause muscle contraction. Magnesium seems to inhibit calcium influx a little bit, which ends up stabilizing the axon. So without magnesium floating around, calcium can enter neurons more easily, and this makes the muscles and nerves more excitable. This can end up leading to neuromuscular symptoms, like uncontrolled stimulation of nerves as well as tetany, which is a condition where there are intermittent muscle spasms throughout the body. These spasms are particularly evident in the muscles of the hand and the forearm, known as Trousseau sign. When the spasms happen in the muscles of facial expression, it's called Chvostek's sign. Severe hypomagnesemia can even lead to convulsions or seizures, as well as abnormal heart rhythms. Now, diagnosis of hypomagnesemia is usually done by measuring the level of free unbound magnesium in the serum, or doing a 24-hour urine collection. Treatment here depends on the cause. So for example, if it's due to inadequate intake, then it can be supplemented orally. In more severe cases, magnesium can be given in the form of magnesium sulfate intravenously or intramuscularly. Alright, as a quick recap. Hypomagnesemia refers to decreased free magnesium ion levels in the blood. And this can be caused by excessive excretion by the kidneys, as well as inadequate intake of magnesium. These situations can lead to symptoms once below 1 milliequivalent per liter. And these symptoms can include uncontrolled firing of the neurons, which lead to muscle spasms, or even seizures and cardiac arrhythmias.